Hi everyone, today we will be doing the medication administration video for John Smith. So today we're going to be using pantoprazole 40 milligram tablets that have been prescribed by his doctor. The reason he needs these meds is because he has GERD, which is gastroesophageal reflux disease. It's a disorder where stomach acids and juices come up from the stomach into the esophagus, and also food can come up and other fluids, which can cause heartburn. The indication of this medication is erosive esophagitis associated with GERD and maintenance of healing of erosive esophagitis and pathological gastric hypersecretory conditions. It can also be used off-label for duodenal ulcers associated with H. pylori. The therapeutic dose of this is to be given orally, and it can also be given IV if needed, but in our case today, they're tablets, and it's to maintain the healing of the erosive esophagitis. And he's going to be getting 40 milligrams once daily. That's the therapeutic dose. And the therapeutic side effects are diminished accumulation of the acid in the gastric lumen with lessened acid reflux disease, the healing of duodenal ulcers and esophagitis, also decreased acid secretion in hypersecretory conditions. Adverse side effects of this drug can be headaches, Clostridium difficile associated diarrhea, abdominal pain, diarrhea, flatulence, cutaneous lupus erythematosus, hyperglycemia, FNE, hypomagnesemia, and acute interstitial nephritis, vitamin B deficiencies, and systemic lupus erythematosus. The contraindications of this drug and the drug interactions. So first, the contraindications are that a hypersensitivity to rabeprazole or other related drugs, and it should only be used in pregnancy only if it's clearly needed, and it should be discontinued if a woman is breastfeeding because it can seriously have adverse reactions to infants. Interactions with this, so drug-to-drug interactions, maplevols of atazanavir or nelfinavir. Avoid concurrent use with either of these antiretrovirals. Absorption of drugs requiring acid pH, including ketoconazole, itraconazole, ampicillin, esters, iron salts, elitronib, myophenolate, mofetil. Contaminant use of azatanavir are not recommended. Also, there is a risk of bleeding if used with warfarin, so please monitor, and hypomagnesemia risk if digoxin toxicity. Now, what we're going to do is we are going to do all of our checks to give the medication. So first, we're going to be performing hand hygiene. So we're going to be using an alcohol-based rub, and we're going to be cleaning our hands. And then we are going to do make sure that the room is okay and that John Smith is comfortable. So you want to ask him if you want to close the blinds, pull the curtain close, ensure he feels that he has privacy. And the most important thing too is to make sure you only draw one medication up at a time. So today, like I said, we're going to do the pantoprazole, the 40 milligram tablets. These are enteric coated tablets, so it's important that John does not chew them, he does not crush them. They have to be swallowed whole, and then he'll have some water afterwards. So what we're going to do first is we're going to check the doctor's orders against the MAR. So we're going to look at the screen and we're going to make sure that the doctor's orders are the same on the MAR, only because the doctor can change the orders at any time. So it's important we make sure they're correct. And then we're going to check patient identifiers. So we're going to look at the MAR and make sure that John Smith and his birthday are correct. And then we're going to look at the pill bottle as well and make sure that John Smith and his birthday are correct as well. So now we are also going to read the medication to ensure we have the correct one. So pantoprazole 40 milligram tablets, we do. And then we are going to make sure we have the right time and frequency of the medication. So John needs to take these in the morning before meals. So about an hour before is when he takes them. That's what the doctor ordered. So at 8 o'clock in the morning, he had it yesterday. So it's just about 8 o'clock this morning. So he's going to get his next dose in the next little bit. And then he will eat his breakfast afterwards. And so what we're going to do is we're going to check the route as well. So these are oral medications. So John's going to be swallowing this pill in his mouth with some water afterwards. And does he have these medications for the right reason? Is he getting them for the right reason? Yes, John is. John is getting these because he has frequent heartburn, and these are going to help lessen the effects. And then before I dispense the meds, one more time, I'm going to make sure that this is the correct medication for John. So I'm going to look at this medication, and it's the Mylan pantoprazole. I'm going to look at the MAR, make sure that's what John needs, correct, and make sure that it's John's birthday, and that it's also John's name on here. And these are 40 milligram tablets. So we're going to open it, and then we have our little dish here. So we're going to dispense 1 tablet of the pantoprazole. So it's going to go right in there, and then we will close the lid, and that is what we're going to bring to John at bedside. So once we get into the room, we're going to do another check, and we're going to make sure, we're going to check his wristband and make sure that his name and his birthday are the exact same. And then we're going to check his MAR and confirm that as well. And then after we do that, we will make sure the medications are correct again, and then go to the screen and see that yes, John needs these medications, and this is the 1 pill I have in here for him. And then I'm going to ask John, do you have any allergies at all? And he's going to say yes or no. And then I'm also going to ask him, has he ever taken this medication before? And he is most likely going to respond yes, because he gets this every morning. And I'm going to ask him if he understands why he's taking this medication. And he knows why, because he gets frequent heartburn. And then I'm going to ask him if he has any questions or concerns about anything before he takes his medication. And John's going to say, no, everything's okay, thank you. And then afterwards, I'm going to go and get a little glass of water for John. And then I'm going to give him his pill. I'm going to make sure he takes his pill and then swallows it back with some water. And then I'll double check that he swallowed the pill. And then I'm going to let him know that I'll be back in about 30 minutes or so just to check on him to make sure everything is okay. And then I also want John to know too that he does have the right to refuse his medication, and he has the right to understanding everything about it. So if he needs anything, I am there for him. And then I'm going to sign off the MAR and make sure that I gave him the medication and when I gave it to him and how he got it. And then every time I did do my checks, I would also sign off saying that I gave all those medications. And that's it. Thank you, everyone.